This interview is part of the Global Feminisms Project, a multi-site international project sponsored by the University of Michigan. Our goal in undertaking these oral histories is to create and preserve conversations with women whose activism and/or scholarship has contributed in critical ways to issues that are important to women. Thank you for agreeing to participate in the Global Feminisms Project. We are going to spend about an hour talking about several topics. We will start by talking about your life and how you became involved in the work that led up to the work you are doing now, your thoughts and insights about your work in the context of the women's movement, and the connections you see between your work and those of activists in other settings. As you think about where you are today, I'd like to start by asking you about your personal history. What were your early years like? What brought you to where you are now?
Thank you so much. I don't know why I'm laughing. Probably because I have so much to say.
Go for it.
So, my name is Kasera Ogola. I go with the pronouns she, they. Non-binary, queer, feminist, activist, womanist, coming from Kenya, but not just Kenya. I love to really speak about specifically where I come from, that is the western part of Kenya, specifically Kisumu County. And the reason why I like to specifically say where I come from, because it is rural, very rural parts of my country, where culture, religion, and beliefs really inform how women and young girls are treated in my community. Yeah. So I was born in not in Kisumu County, but Siaya County in 1986 on 22nd of August. So that tells you how old I am. I think my mom moved from Siaya County to come and start a small business in Kisumu County to take care of the five of us. I'm the third born in a family of five children, though I lost my younger sister 3 years ago.
Oh, I'm sorry.
Yeah, it's okay. So the reason why my mom moved from her matrimonial home to become a single mother in a peri-urban area that is Kisumu is because I know for sure that she stayed on in a very abusive marriage for a very long time. And I think, as she tells us, by the time she was leaving, we were pretty young. I think I was around 3.5 years old. And the reason why she left is because the physical abuse got so bad to a point. I think the last time my dad beat her, she was in a hospital for more than 3 weeks.
Wow.
Yeah. So from the hospital, she came home, picked us. I can't remember,
Right.
so much about that. Most of this is, reported or by her telling us stories about her life. So she came, picked us, and went to her sister, who was also, married nearby. They're married in the same village. Took us to her sister, and then, of course, moved to Kisumu to look for work or to start a business. So I remember Kisumu. When we got in, my mom had a small food kiosk by the roadside selling porridge and a local delicacy called githeri to local construction workers as I started nursery school. And I remember we were very happy, we were very happy because we were seeing my mother happy. And every morning as I left for the local nursery school, of course I would pass by the kiosk to take breakfast before I go to school. And I remember, because I was a very talkative, I was a very extroverted young girl, I remember I would get into the kiosk and, you know, do poems for for the patrons.
Yeah.
Those are the memories I have. And then I think after a few years, I think when I got to class 2, class 3, I remember my mom closing the kiosk because the business was not doing very well. Then she got a job in a local bar. Yes, as a bar hostess. This small bar was called Simboi. You know, I love saying, I love mentioning the name Simboi because Simboi bar became a very important part of my life, and I think the bar really shaped how I viewed life, how I viewed men, how I viewed, you know, sex work, how I viewed patriarchy, how I viewed, you know, feminists or feminism. Because of the experiences that I went through now growing up, knowing that, you know, my mom works in a bar and all the stereotypes that comes with a single mother of 5 kids staying alone and working in a bar. So my primary school life was very happy, I can say, because my mom made sure that, you know, I had everything I needed. And when I'm talking about everything, that is just a school uniform and making sure that, you know, every evening we have food on in our stomachs. But my social life was not as good as a young child my age during that time would want their life to be, because kids would poke, kids would make fun. And not just kids or my friends, but even the teachers. You know, if you made a small mistake, they'll make a reference that you're behaving in a certain manner because your mom, you know, works in a bar setup or is a barmaid. Because in my community, you know, any woman who works in a bar or who works in a setup that is not considered normal, you know, is seen or perceived to be promiscuous, is perceived to, you know, to have bad manners. Yeah, so I grew up with most of my friends and, you know, my teachers in primary, you know, calling me a prostitute's daughter. Yeah, so that got so bad, I think, to a point that I didn't have very close friends. I was always very, very cautious who I hung out with, because the name calling sometimes would result into physical fights, because I most of the time I felt the need to, you know, protect myself from the jokes. Then apart from the physical fights within my friends, keeping up a friendship for a very long also was difficult, because parents of my friends, specifically women, you know, would caution their daughters, you can't be friends with Kasera, you cannot be friends with Kasera or you'll end up like her mother, because her mother works in a bar, you know. But at the same time, I want to believe that that also shaped how I view platonic female friendships. I have a problem letting go of friendships, because I understand firsthand the importance of being loyal to a friend, being understanding to a friend, loving a friend beyond who they are, loving a friend beyond you know, the household or the community they come from. So I would get a few friends who would stick with me, and, you know, I would protect that friendship very viciously, because I would not want to let that go.
Right.
Yeah.
Right.
I finished my primary education in around 1998.
Okay.
Then, of course, proceeded to high school. I first went to a not boarding, I first went to a day school just in town, near the village where we were staying. And that was also very difficult, but in terms of school fees, socially, not everybody knew my, you know, where I was coming from, what my mom was doing, and I didn't feel the need to always, you know, talk about where I come from or what my mom is doing. So the first 2 years of my high school in a day school was really, really awesome. But unfortunately, when I was getting into Form 3 or the third year, I was sent away from school because of, you know, lack of school fees. So I went back home, stayed home for 1 whole year. But during this 1 whole year, I was helping my mom because in her free time from Simboiba, where she worked, she would make locally brewed liquor or alcohol or busa in my, we call it busa in my language. Every week we would have, you know, patrons coming in our house to take the liquor, and we were doing this to collect money so that I could go back to school the following year. So, you know, that exposed me to men, because most of our customers were men, were males. So every Friday we would have like more than 50, 70 people coming in and out in our house to take the liquor, but 90% of the time I was the one in charge of selling for them.
Oh, wow.
Yes, I was the one in charge of selling for them after my mom brewed it, because she had to, you know, leave for work from 2 p.m. up to probably the next day. So I would stay there, sell for men, and the abuse was out of this world.
Wow.
The abuse was out of this world. From abuses, from people touching you without your consent, because they feel they have a right to touch you, because, you know, you've welcomed them in your home. You're selling them alcohol. You're a young girl who is so naive, you know. These are old, grown-up, you know, men. The harassment was so bad, but I had to put up a face. I had to endure to a point of, you know, making jokes with them that I'm okay with it, because the goal was to sell a whole pot or even 2-3 pots of, you know, the liquor.
Wow.
You know, the touching. Some clients would even follow you inside the bedroom. Wow. When you go looking for change, some would follow you into the kitchen, and, you know, them following you into my mother's bedroom to look for change, or in the kitchen, would not just end with, you know, them following you. It would end with someone touching your butt, or someone touching my breasts, you know, someone asking for sex. You know, yeah,
Wow.
It was very bad. So I had to go through that for almost 9-10 months.
Oh my gosh.
Yes, every Friday.
Wow.
Every Friday. And I think the only day I would not be selling that local liquor was when we could not get maize or the raw ingredients to make the liquor. Yeah, so I was, as a young girl, I was always looking forward to the days when my mom would not get the raw materials, because then I would, you know, breathe.
Of course.
That Friday I would breathe. Nobody, you know, would touch me. Nobody would abuse me. Then the next Friday, the same thing.
My goodness.
So that was my life. After around 9-10 months, the following year in January, I managed to go back to school with the savings that we made from this. Went back to school, but now not to a day school. I went back to, we were able to save enough to pay the first 1 year of the third year. Then I went back to a boarding school, now in Western Kenya. But in Western Kenya, because nobody also knew my background, where I was coming from, I think they were the best 2 years of my schooling. But they were the best 2 years of my schooling only when we were in school. Because when we went back home during the short breaks or the long breaks, I would go back to a space where I have to take care of men who abuse me, men who touch me without consent, you know, until opening day. So that was my life. And I think the experiences, seeing my mom really struggle, or seeing my mom forced to put me in a space where I faced constant harassment from men every day, you know, also made me very protective of myself. But in terms of my sexuality, I think I was attracted to girls very early on in my life, but it's something that I think I pushed at the back of my mind or brain, because I faced sexual harassment every day, so I didn't want anything to do with, you know, sexual relationships. So I didn't experiment so much with my sexuality the whole of my high school days. So finished school in 2003, my fourth form. Came back home, but because during high school, specifically in boarding, I used to make my friends' hair. I also learned that I was very good at, you know, making hair. So the first thing I told my mom when I finished Form 4 is that, you know what, I'm not selling alcohol again. I don't want to be constantly I don't want to be constantly be harassed by men, touched by men. It's not okay, and I don't want to do it anymore. So I'll look for a job in a salon and, you know, fend for myself and support you where you know I can. But I think all those the constant sexual harassment that I faced growing up, you know, also made me promise myself that one day if I had kids, I would not want to be a single mother. I would want to stay in a marriage, so because I believe that being a normal family consisted of a mother and a father and children, and that provided security that I feel I did not have. You know, I feel I did not have. So I said, you know, if I get married and have kids, I don't think I would want to live that marriage, because I would want to protect my children from the experiences that I went through. So finished school, moved to Nairobi, a bigger city, to look for a job. You know, started working. I got a one-roomed house. But before I moved, the period between me finishing high school, going to start work in the local salons before I migrated to the city, I got pregnant and had my firstborn son. So when I moved to Nairobi, I left the boy with my mom, but of course after a year, I came for my son and moved with my son to Nairobi so that it could start you know, daycare. And then I met someone. We dated for a very short period, I think 1 month. 1 month, and we already moved in together. You know, and for me, I think what I needed during that time was security. I was in a big town, a big city, a young single mother who wants to run from everything that she's gone through. You know, my mom is single with 5 kids.
Right.
I'm now single with 1 kid, and I don't know what the future holds. So I think what was scary for me the most was the fact that I would end up, you know, like my mom. You know.
Yeah.
So when I met someone, moving in immediately was not very difficult, because I didn't want to reinvent the wheel, or I didn't want I didn't want the life that we had, that my mother gave us. I know she gave us the best, but I was 100% sure I didn't want that because of the sexual experiences,
of course,
or harassment experiences that I had. So I moved in. Then after around two years, I realized that probably it was one of the worst mistakes.
Wow. Wow.
One of the worst mistakes I've ever done in my life.
Wow.
No physical connection, no emotional connection.
Yeah.
And of course, with those, there's bound to be problems, you know, there's bound to be problems in the marriage. So we stayed on with the emotional abuse, with everything that was going on, with both emotional, economical abuse, no physical attraction to each other whatsoever. I must say that I really tried, because I did see a life outside, you know, I didn't want to destroy or crumble the setup that, you know, that I had. Went ahead and had my second born. Went ahead and had my third born. Then we moved back to Kisumu. So after moving to Kisumu, went back to work in a salon, of course, but women, specifically women who work in salons, that's my experience. People talk so much about their sexual experiences, whether they are customers or not. So, of course, in Nairobi, you know, my friends would make stories about sex. And I was there, you know, asking myself, what are these women talking about? I've never experienced any of these things.
Right.
So for a long time, I thought there was something wrong with me. For a very long time, I thought that my past sexual harassment experiences, you know, made my mind not accept sex. You know?
Yeah.
So to keep up or to learn more about from the women, I would also pretend that, you know, I get what you're saying. It's like that, but I had no idea what orgasms were, what good sex meant. I had no idea. So, but fast forward, when we moved back to Kisumu, I made a decision to go back to school, because I did quite well in my final high school exams. So I made a decision that I wanted to go back to school. I didn't want the kind of life I was having. Then made plans, applied for a medical course in the local Kenya Medical Training College. Got in, but I think when I got in now, that was the start of the end of my marriage, which right now I think I'm very glad that it worked out that way. After 2 years, got my first job in a local hospital, and I think working and being financially independent also just broadened my mind to, you know, beyond the marriage I was having, broadened my mind with my sexuality also. And because by this time we had separated with my husband, though we were still staying in the same house, but we were not together as a husband and wife. Started exploring now with my sexuality. Started getting involved in, you know, community spaces where young women would convene and talk about their experiences with gender-based violence. And I didn't know all this while that all these were, you know, feminism. I didn't quite understand, but what I was sure of is these spaces made me whole.
Yeah.
These spaces gave me a reason to wake up every morning to work even harder. Because I think we were all in agreement in those convenings that you know, as a woman who is not dependent on a man, you can make your own decisions, however harsh it is, however critical the society, you know, gets.
Right.
But it's better you'll be criticized by the community, you'll be criticized by your friends, but you're happy. So I continued attending these meetings, and how I got into these spaces, when I was working in this public health facility, I was specifically working at the CCC Center or HIV prevention, care and prevention setup as a dietitian, and we had a support group for women living with HIV and also struggling with their weights as a result of the side effects of some of the antiretroviral medications they were taking. So we formed, as a department, we formed a support group for these women. So we would meet twice every month, and when we met, the conversations moved slowly from the side effects of medication, from the importance of adherence, from nutrition, from exercise to their lives, you know?
Yeah.
So that's where we started these conversations with these women.
Yeah.
So they would come twice every month. We would talk about gender-based violence. We would talk about their social economic struggles. We would talk about a lot of things. We would talk about patriarchy. I didn't know it was called I didn't know the word patriarchy, but we would talk about, you know, the society, the systems, and even the men within the households, you know, making their lives or our lives very, very difficult. And then slowly those conversations progressed to, you know, social economic empowerment. Can we invite someone to come and give us a talk about, you know, how we can, number one, start a merry-go-round, you know, within us, so that we can take loans amongst ourselves, so that we can start business amongst ourselves. You know, those are how those conversations started. So I worked with the Ministry of Health, running these support groups with my colleagues up to around 2019. Because I was seconded to the Ministry of Health by a local NGO partner, and the HIV funding, I think, during that time was also shrinking. We lost our jobs. Some of us lost our jobs. I lost my job in September of 2019. So by the time I was losing my job, we were already getting invitations to attend, you know, feminist meetings outside now, you know, the hospital, outside the support groups. You know, one of them would say, Kasera, there's a meeting I would love you to attend, to give them a talk about nutrition. So that's how, you know, my network, you know, expanded. So by the time I was losing my job, it was not very difficult for me to, you know, continue engaging in local women organizing within my county. And then I think during that time also, there were a lot of femicide cases in Kenya. We had a governor who was accused of killing her girlfriend, plus the unborn child. And of course, we had so many other deaths that were highlighted in our local TV stations and radio stations. And, you know, conversations started on social media in the local media about the rising cases and the need to do something about it. And I think that year, around the next year, that was 2019, around March 8th, on International Women's Day, we held the first anti-femicide protest in Kisumu.
Wow.
Yes, and by the time I was going back home, I was like, oh my goodness, this is what I want to do.
Oh, yeah.
You know, this is what I want to do. I want to speak for women who are not able to speak for themselves.
Right.
You know,
right.
I want to, in my own small way, I want to make my community a better space for young girls who are just born, who are still very young, so that they cannot go through the experiences I went through while I was growing up. So after that march, I think that is how the feminist social movement in Kisumu started. Then with a few friends, and of course new friends that I met during the march, we met and started Kisumu Feminist Society. Registered Kisumu Feminist Society, you know, and I want to believe that that is what formed so many other local non-profits, you know, programming around women's rights in my community. And the reason why there was a mushrooming of small other non-profits to work around feminist issues or gender equality issues was that the existing feminist movement, I think, was being run by older women. And I don't know where the disconnect was, but there was a very strong urge for young, like-minded feminists to organize, you know, to organize. And then, of course, during this time, I also became very active in the queer movement. By this time, I totally embraced who I am. I had even met my current partner. So I got very, you know, involved. What is happening where? I wanted to be everywhere at the same time.
Right.
But of course, the queer movement in my country, as much as it was started by queer or female assigned at birth lesbian women, it is very robust because the government programs for male assigned at birth persons through the National AIDS program, that is NASCOP in my country. So, you know, as a medic, I also started seeing gaps that the queer movement was only programming for male assigned at birth queer persons or MSMs, but very little health programming for female assigned at birth queer persons. So I think we had a discussion with a group of doctor friends of mine who we had worked with in the local hospital, who are also queer, and we said we can do something about this. We can bridge the gap. You know, we can program for queer women, specifically health programming for queer women. So those kind of conversations led to us founding and registering a non-profit called Lake Region Women's Health and Equal Rights. And we are currently partnering with the Ministry of Health. We are running the first ever LBQ GNC clinic in the whole country, specifically giving a comprehensive sexual reproductive health services for female assigned at birth queer persons only, because the male assigned at birth are already being programmed for by the government. Yeah, so the organization, we registered it in 2001. We formed it in 2020, of course. 2001 got formal registration with the government, and right now it's doing really well. And the fact that it is a safe space for queer women, it is a space where you can walk in anytime and get free health services, is something that is I'm very, very proud of, you know. But every intervention, every program that we come with in that space is centered around feminist values, because I believe that I'm a feminist first before anything. Everything that we do is centered around feminist values. Yeah, so I know it's a lot, but that's my story.
Yeah. Oh wow. Thank you so much for sharing.
That's my story. Yeah, that's my story.
Yeah.
Yeah.
I wanted to ask, I'm curious, when you're thinking about these communities that you've been a part of that have provided support for queer women or victims of domestic abuse, how do you navigate talking about these issues that are so culturally stigmatized in your communities that you've grown up in?
It's very difficult.
I'm sure. Right.
It's very difficult because the kind of for a very long time in my country or in my local community, most non-profits, be it mainstream feminist movement or queer feminist movement or organizing, or mainstream human rights organization, whether it's being led by cis men,
Right.
we've always worked in silos. Everybody, you do your thing, and the reason I believe we've worked in silos like that is because if you are a queer person like me, you get into a mainstream feminist space, there's always some sort of stigma and discrimination,
Right.
because even in the mainstream feminist organizing, there are biases, that each and every individual brings into that space. Before someone identifies as a feminist, there's somewhere they're coming from. There's a religious belief or a sect that they ascribe to. There's the way they were brought up in the household. But most feminists or most human rights actors or activists unconsciously bring these biases without even them knowing that they're bringing those biases. So you'll find yourself in a mainstream feminist space. You say, oh, my name is Kasera, I'm a queer activist and I'm happy to be here, and everybody will look at you like, where is this one? Where is this one coming from? So talking about the challenges that we have as queer people, as queer feminists, is challenging, even in mainstream queer spaces.
Right.
So you can imagine how difficult it is to, have them in purely heterosexual spaces. It's difficult, it's challenging. So the kind of advocacy we've always done is in silos. But because even as queer feminists, we've not been getting a lot of headway with the advocacy, advocacy efforts that we put in, we sat down as Western Kenya feminists and said, you know what, as queer feminists, we don't need to work alone, because if we work alone, we would not, achieve what we want to achieve.
Right.
We would not leave the space better for, younger feminists who are coming. Let's find a way of finding intersections with the work we do, with the work that the mainstream feminists do, with the work that the mainstream human rights organizations or non-profits in my locality do. Let's find intersections and have conversations and find areas of partnerships, because at the end of the day, we are fighting for the same we are fighting for the same thing. We are fighting patriarchy. We are fighting, the systems. We are fighting for gender equality. We want the place or the community or the world to be a better space for all women and young girls. So we started working together. We started being very intentional into penetrating the mainstream feminist spaces. We would not only go into their spaces, but we would invite them to attend some of our forums, to give talks in some of our forums. We would create spaces, or like the feminist convenings that we were organizing. We would give mainstream heterosexual women or feminists, roles so that all of us owned, you know, that space, then I think that created a safe space for both of us, you know, for heterosexual women and for queer women to come together to share their experiences, giving them roles and making them a part of that process, you know, allowed all of us to be vulnerable so that we can have the difficult, you know, conversations, you know, and that has happened for a very long time. And then, of course, in our own organizing, apart from working with feminist organizing, because our interventions go beyond feminist work, we program around health service provision that you know, allows us to engage every day with the mainstream healthcare workers giving services within public health setups. Our interventions allows us to work directly with local religious leaders because religion, I always say that religion is the father of all patriarchy. Because the Bible has been used for a very long time to, you know, to stifle women's voices, you know. So we work with religious leaders. Apart from working with religious leaders, we also have to work with cis heterosexual men who hold very privileged positions in all stakeholder institutions like the Ministry of Health, you know, like other government agencies, the gender departments, you know, the law courts, you know, and other private institutions. So we had to sit down, come up with a communication and advocacy strategy so that we know how to engage the healthcare workers, the religious leaders, the people who hold position of power, including police persons, including local government officials in the villages. So I think these documents guide us on how to have these conversations, because the way I would talk to a government official to understand my issue so that they can include our issues in the policies that the government makes is not the same way I will have a conversation with a religious leader.
Right, of course.
Yeah, so it's difficult, but those conversations are happening. They've been happening. It's just that in the last 2 years, things have really taken a shift because of the anti-gender movement that is very, very rife in my country, but not just my country, but in Africa as a whole. So we are back to square one, and you know, having conversations, coming up with strategies on how to gain ground again, so that we don't lose all the gains that we have had in the last years.
Right, right.
Yeah,
that's interesting. You talk about wanting to like set a foundation for feminists and activists to come. Can you tell me a little bit about some of the like maybe role models in your life or the movements that you feel yourself are building off of in your own work?
In my community?
Yes, yes.
So in my community, we have women, very strong women that we found already doing the work. We have one Easter. Easter does some very, very good work. I think she works in the whole of nationally, but when I met Easter was working very rurally in somewhere in Siaya. I think her office is somewhere in Siaya County, more remote than now where we're staying in Kisumu. Okay. But I think they were the first, she's the first person that I looked up to in the community. And then of course, people like Caroline, who were in the movement before I got in, we look up to them to, of course, give guidance. Apart from just giving guidance to mentor some of us who got into the movement a little bit later. And then, of course, nationally, we really look up to a member of parliament from Migori, called Millicent Mabona, a very strong woman in the Kenyan parliament, a very fierce feminist who does not fear men at all.
That's wonderful.
You should see the parliament sessions. when she puts men in their places. So I think she's also someone that I personally look up to because I love her politics, I love her feminism. And then, of course, apart from Millicent Mabona, we also have a member of parliament at the national level called Esther Passaris. Passaris is very, very passionate about women's rights in Kenya. And I think what drew me to Esther Passaris is the love and the support that she's continuously given the queer community in Kenya. She's never been afraid to, you know, pick up a placard, you know, that says love is love. When we organize protests at the national level, you'll always see her at the forefront. And even recently, because the femicide cases are really, really, really shooting at the roof in Kenya right now, and we held national anti-femicide movements all over the country a few months ago, I think in January. And, you know, Esther Passaris was at the forefront, you know, at the forefront, and us at the grassroots, when we see Esther Passaris carry a placard standing in solidarity with women all over the country, with queer persons all over the country, then you know it gives us that affirmation that you know it's all is not lost. There are still government officials who believe that these works needs to be done. The government officials who still believes that going to the streets to demonstrate, to call government to action is still very important. So those are the three people that we look up to, or I look up to personally.
That's wonderful. Thank you. What would you say, and I know you've talked about this a little bit already, what would you say is the significance of feminism to you? Like, how do you define it for yourself?
So feminism to me, and what it means to me, is just working every day to dismantle patriarchy, to dismantle systems that oppress women. And when I'm talking about systems, I'm not talking about big government, you know, systems.
Right.
I'm talking about systems that exists in our local churches, systems that is the Bible, systems that is even within the household. And I'll give you a very practical example that in Kenya, specifically in my community, in the Luo community, when a mother cooks chicken in the household, it's very sad that the children in that household will not be given chicken parts with meat. And it's even worse for young girls. It's even worse for young girls, you know. So you'll find all the meaty parts are kept for the man.
Oh man.
You know, and even for the children, the parts with very small meats are given for the boy child.
Wow.
And you'll find the girl child eating vegetables and soup, or even with chicken feet or chicken head. If you're lucky, chicken wings. You know?
Right.
Yes. In the households, the girl child is given the last option when it comes to schooling. I know that is changing, but that is still reality of most rural women. You know, the family will always give preference to the male child.
Wow.
So for me, feminism means speaking up against that. You know, telling the household that this is not okay. We are all children. Give us the same opportunities. You know? So simply put, that is what feminism is to me. Just finding ways every day to dismantle patriarchy, because it doesn't mean that I have to carry a placard to say, oh, you know, fuck patriarchy.
Right.
You know, it means a young girl or a young woman in an household speaking up against any injustice that they see. So for me, it starts within the household, even before we move outside. So that is what feminism is to me.
Great.
Every day in my actions,
Right.
speaking against the system that oppresses women.
Right.
Yeah.
Right.
Yes.
Have you always considered yourself a feminist? Would you say when you were younger that maybe you didn't use that term to describe yourself? It was something that you evolved to?
Yes. I think I've been a feminist for a very long time, from a very young age. I didn't know it was called feminism until later on in life, because I told you about my experiences in primary school. They were pretty bad.
Yeah.
But I would always, stand up for myself and fight, as much as it was embarrassing, because I think at some point, I also believed that it's wrong. My mom is not supposed to be working in a bar. But at the same time, I cannot tell my mom not to, because I'm very young and I'm going through all these things. But because I could not talk to my mom, I could not share my experiences with the teachers, because I would get the same treatment from some of the teachers.
Wow.
I was alone and I needed to fight, to speak up.
Right.
That was feminism. When I was selling liquor and men would constantly, touch me, I knew deep down in my heart that it is wrong. They're not supposed to touch me. And, sometimes I would refuse to sell. If you follow me into my mother's bedroom or in our bedroom when I've gone to look for change, I would speak up, but I would be overpowered because there were so many and I needed the money.
Right.
Getting the strength finally to walk out of an abusive, loveless marriage after so many years, that was feminism.
Of course, right.
To me. So, yeah, if you ask me if or when I knew, I cannot specifically say when, but I know that it's something that started early on when I was a young girl.
Right.
Yeah.
Right. How have you seen your work and your activism change throughout the pandemic and with COVID?
Yeah, I think the way we program or the way I practiced my feminism changed a lot, especially during COVID, because I think when COVID started, we all assumed that, this is just in Asia. And it's in the US and it's in Europe and Africa. We are safe.
Right.
And when the first case was announced in Kenya, we knew it is only in the capital. We're in the rural. There's no way. Right. There's no way it's going to reach my community. Until we had the first death, the next. And the next and the next, and the lockdown came, and the lockdown came, and I saw firsthand how my peers struggled to even put food on the table.
Wow.
I come from a community where we program for young queer persons who have been and continues to be disadvantaged because the system, the beliefs, the cultural practices and beliefs did not allow them to reach their full potential, to finish school so that they can be socio-economically empowered just like any other person.
Right.
So most of them are young queer people who were only doing casual jobs in hotels, in bars, and when lockdown came, all these businesses were closed down. So as leaders, you'd get calls. Kasera, I'm going to sleep hungry today. I've not paid my rent. I'm sick. I can't get to the hospital.
Right.
So we had to very fast regroup as leaders, reach out, look for resources. And by that time, we were not having physical meetings, of course. So the only program we had were food drives. Look for money, buy food, find a way of how these supplies can reach each and every individual that reached out. It changed my perception towards justice. I started reading about transformative justice. I started understanding that, you know, young queer people do not get into criminal activities because, you know, they want to get into criminal activities.
Right, right.
And if they get into criminal activities, you know, how do we give them support instead of coming up with punitive, you know,
right,
ways? It's making the situation worse, not just for them, but even you as a leader, you know, because then it means that we continue to enable and continue to feed a capitalist system that do not favor, you know, women.
right.
You know, it really shifted my mind about transformative justice. And I think during this time also we had a lot of cases, because I happened to be working around safety, security and response for queer persons in my community. And during COVID, I think 90% of the cases we were handling were intimate partner violence. So we had to think very fast. We had to ask ourselves difficult questions. You know, how do we come up with programs to mitigate the rise in intimate partner violence?
Right.
Not only taking care of the survivors that were coming forward, but also taking care of the perpetrators. You know, just coming up with interventions by giving it a feminist lens, and of course by practicing radical sisterhood, you know.
Right.
Yeah, because it was very clear that there was a shift. We were having cases of intimate partner violence, but with COVID, you know,
right.
Even couples that, you know, we all knew in the community started coming forward that my partner beat me. We started having conversations online, you know, what might be the root cause of all this violence amidst COVID, amidst people lacking food. What is it? Then we noticed that most queer people, the lack of food led to frustrations within the spaces that they were living in with their partners, and most of them were forced to stay together because of the fear of going back home to their families.
Wow.
You know?
Yeah.
Because you can imagine, you are a queer person who was sent away from home because of your sexual orientation and gender identity. Then comes COVID, you cannot pay your rent, you cannot buy food. The only place you're supposed to think about is going back home. So you can imagine if you're in a space where nobody wants you for 2-3 months, and we didn't know how long the lockdown was going to be. So very many people preferred to come together as couples and stay. So most of them were learning about each other for the first time.
Wow.
They're struggling to put food on their table. There's no work. It was crazy. It was crazy. So my mind shifted because of COVID. Started thinking more about transformative justice, as I've told you. We came up with a support group to support the survivors, of course, with meetings here and there online. When we get time, because sometimes the lockdowns were lifted. So we would have a support group for the survivors, but also have support groups for the survivors, so that we intervene for everybody. Right. So we called it practicing radical sisterhood. You know, we leave everybody by not leaving anyone behind.
Yeah, that's really great. What do you see as the future, your future hopes for the organizations you're working with?
So specifically for the organization I'm working with, let me just first of all give you a context of where we are programming right now.
Sure.
I mentioned that the anti-rights movement has really penetrated my country. Currently, we have a bill. It's called the Family Protection Bill, or the Kaluma Bill, because the gentleman who has proposed this bill is a member of parliament coming from somewhere in the somewhere from Western Kenya also, called Peter Kaluma. So the Family Protection Bill proposes to criminalize same-sex activities in my country. The Family Protection Bill not only talks extensively about homosexuality, but also about comprehensive sexual education, comprehensive sexual reproductive health and rights for all women.
Right.
And apart from the bill, we've seen a rise of revolt from the religious leaders, both Islam and Christians coming together to hold protests about homosexuality in my country. So this has not only affected how we program in the country, both at the national, the regional, and even at the grassroots level, but it has also contributed to a lot of human rights violations that is specifically targeting transgender women, masculine presenting lesbian persons, gender non-conforming persons, and we've seen a rise of attacks, both online and physical attacks, you know. And the fact that the gender-based recovery centers within the local police stations and even the hospitals, you know, the systems are made to respond to heteronormative women, you know, attacked. It's very, very difficult as a queer person to get help from the police. It's very, very difficult to get help from the local gender-based recovery centers within the government hospitals. Or if you rush to these spaces to get help, then it forces you to present as someone you're not in order to get help.
Right.
You know, so apart from the protests and the violations, the advocacy interventions that we've had as a movement online has also really suffered, because not only the government but also the public, you know, profiles and the harassment is just out of this world.
Yeah.
We've had cases of my peers going through mental breakdown because online trolling. That is not the online space is not moderated. You know.
Yeah.
Especially Twitter and Instagram. Or even Facebook, people will troll you. People have been innovative with words that, you know, Meta will not pull down.
Wow, right.
People have become innovative.
Yeah.
So both online and physical spaces are not safe for queer persons in my country anymore. So right now, the future looks very bleak. For us as a community and even as an organization, because the proposed bill will also proposes to, you know, look into or scrutinize the donors bringing in the money to support the work that we do.
Wow.
So the future looks very bleak, but I want to be very hopeful. And the reason why I'm saying the future looks very bleak is that, you know, as a queer feminist who also not just advocates at the grassroots, national, regional level, we've also really tried to penetrate the global space, like the CSW, to understand how the international human rights mechanism systems, you know, work.
Right.
And last year we attended our first CSW, and it was our first time. We were still learning how CSW works, you know, where to go, what to do, which side events that are relevant with the feminist work we are doing, with the queer feminist work that we are doing. I didn't see so much opposition last year, but this year it was different. I'm still shocked.
Yeah.
But at the UN, we have opposition, the anti-rights movement within the UN.
Wow.
You know?
Yeah.
And they're not hiding. They're in plain sight. They're in plain sight. I was in New York for 1 week, and in all the queer feminist side events that I attended, the opposition, the anti-rights people managed to get into all those spaces to monitor what we do, what was being said by who. Basically, I think they were doing opposition monitoring.
Wow. Oh my goodness.
There's no meeting I attended, and in a day we would have like 4 to 5 meetings every day for the 1 week I was in New York. There's no meeting that I attended that did not have an anti-rights person amongst us, and they were not hiding. They had these big yellow badges. You know, apart from the bilateral meetings that we attended with states and with the UN women, I didn't see any anti-rights because those are very, you know, closed door.
Of course, right.
Closed door meetings. But the other meetings, the anti-rights are there, and I'm even shocked that the anti-rights or Family Watch, I think they're called Family Watch International, led by, I think, Sharon Slater. You know, they had their own parallel events, you know. The negotiations or the high-level meetings that are happening within the UN. Sharon Slater is also sitting there, and you know, Sharon Slater and her organization is known as one of the people who fund anti-rights movements, you know, in Africa, and it's really sad. So I think my experience for the last 1 week in New York, especially when you're in a space with donors and you ask the donors, what does this mean for us as a movement? And the donor tells you, I don't know.
Oh, yeah, that's terrible.
I don't know. It is terrible. It is terrible. So that's what I'm telling you. I don't know what the future holds, because in Kenya, the Family Protection Bill is supposed to be tabled in Parliament anytime. Anytime it will be tabled in Parliament, and if it goes the Ugandan way or the Ghanaian way, I don't know what that will mean for us. I know we've sat down as a movement in Kenya. We've come up with strategies to try and, you know, mitigate the effects that will come with that bill being passed, because we are dealing with the effects right now. It's a proposed bill, but we are already dealing with the effects of the proposed bill. So we can't imagine the magnitude of the challenges or the issues we'll be forced to deal with after it has gone to Parliament and probably the President has sent it into law. So if you ask me what the future holds or what I see my organization or the activism or the feminist work that we're doing in my country right now, I do not know what that future looks like. Number two, the reason why I don't understand how that future looks like is because for a very long time we've had a very cordial working relationship with the mainstream feminist movement, mainstream sex work movement, government agencies, religious leaders, and even local government officials in the villages. But we've seen a shift of that relationship change immediately the Family Protection Bill was proposed. We've seen allies, you know, turning their backs and not wanting anything to do with the queer feminist movement in Kenya. So people we thought were allies are not allies anymore.
Oh, man.
Probably apart from the sex work movement, but the sex work movement also cannot speak on our behalf because there are not so many in my country. But also Kenya is also a country that criminalizes sex work. You know, so queer feminist movement and the sex work movement, same WhatsApp group. So we needed, this is the time we needed all the other allies to speak on our behalf, but they're not able to do that because they also fear that they'll be targeted, you know, especially now that there's a clause in this bill that specifically says that anybody who associates will also be, you know, criminalized.
You
know, anybody who carries money on behalf of queer organizations will also be held accountable by the government. So I think all the allies want to be safe. Yeah, so that allyship is not there anymore. We are struggling to program, to work with the former allies. So that's what I'm telling you, it's very, very bleak. But one good thing that has also come out of these and that is giving, I think, all of us hope, even if it's tiny, is that for the first time, movement building in my community is stronger than ever before, because we have created synergies between grassroots organizing and the national organizing, and we are able to sit in one space and to come up with strategies that if this happens like this is how we are going to go about it, which has not been there before. And of course there's a power in a movement vis-a-vis working in silos. So I think the fact that we are working together, we are speaking in one voice as a queer feminist, as a queer or a feminist movement in Kenya, that should not go for nothing.
Yeah,
it will account for something.
Right.
Yeah.
For sure, that's huge. I think those are all the questions we have for you. Is there anything else that you'd like to share with us before we end?
Not really, but I think we'll have conversations after you interview.
Absolutely.
After you interview Rucah.
Yeah, that would be wonderful.
Yeah, because it would really be interesting to know about how you organize in a world that is progressive, but also we understand, or I understand that for a very long time we viewed the United States or countries from Europe as very progressed, but we are seeing a situation whereby the anti-rights is not only affecting the African context or the Kenyan context, but it is affecting all the movements all over the world. So it would be interesting to also just get your perspective or your experience with living in a progressed country that is also currently grappling with the anti-rights movement. Yeah, it would be interesting to hear that from you.
Yeah, we're definitely looking forward to collaborating with both of you. All right. Well, I think that's all we have.
Thank you.
Thank you so much for joining us today and for sharing your story. It's been great talking with you.
Thank you so much.